Hey there, and welcome to the Conduit Street Podcast. I'm Jack Wilson, 2025 MACo President, and proud to represent Queen Anne's County as their District 1 Commissioner. Here we break down Maryland's biggest policy debates, hear from the experts, and even throw a dad joke or two. So sit back, stay informed, and enjoy the conversation.
Hello and welcome to the Conduit Street Podcast. This is Karrington Anderson from the MACo policy team. I have a special guest joining me today, and we are going to dive into the opioid crisis and remediation efforts in Baltimore City. The opioid epidemic remains one of the most urgent public health crises of our time. Throughout Maryland, we've seen the devastating impacts firsthand. At the same time, jurisdictions have been on the front lines of response. Baltimore City in particular has been pursuing legal action against pharmaceutical companies investing in harm reduction strategies and recently releasing a preliminary overdose response strategic plan to guide the city's next steps. The challenge before all of us is how to turn these strategies into lasting change. To help us explore these issues, I'm honored to be joined by Councilmember Phylicia Porter. Born and raised in Baltimore, Councilmember Porter brings both lived experience and deep professional expertise to this conversation. She has dedicated her career to advocating for vulnerable and underserved populations, and she currently represents Baltimore's 10th district on the City Council. Without further delay, Councilmember Porter, welcome and thank you for being with us today.
Thank you so much, Karrington. I'm super excited about this conversation.
Yeah, absolutely. Well, we appreciate it. So yeah, thanks for joining us today. But before we dive into all of the moving pieces around the opioid crisis and remediation, tell us a little bit about what brought you to this work.
Yeah, so I'm a born and raised and educated in Baltimore, and that spurs my empowerment, but also my catalyst for this work. With many families in West Baltimore and just Baltimore in general, the substance abuse, mental health, and opioid crisis has been ingrained in my family for generations, and it allowed me the lived experience, but also having an opportunity of connection with families and community and how I exist. It has allowed me a much better and more poignant approach to how I approach public health in the city of Baltimore.
That's great. And something that I love about you is you're not just doing this work locally either. You also spend time advocating in Annapolis at the Maryland General Assembly. I've seen you there multiple times. So how was this past legislative session for you?
This past legislative session was very important for me, and I'll tell you why. I'll tell you for a few things. Because I knew the great work that had been happening within the city of Baltimore under Mayor Scott and City Solicitor Ebony Thompson, but also the national level. I'm fortunate enough to connect with other cities in my professional capacity, learning what they're doing from a state level perspective as it relates to the opioid crisis, but also kind of learning their lessons learned. In this past General Assembly, I will say that Maryland actually performed some great strides as it relates to legislative actions at the state level to be used as an incubator for any type of innovation and initiatives that are going to happen in cities like Baltimore. So, for example, when we're looking at how the state responded to the opioid restitution funds, that was a large feat, a large feat.
Right.
That many states are undertaking, but the way that we are utilizing those funds, prioritizing and centering community and the response was very novel, but it was also in Maryland's blueprint. So Maryland has always been a state, and the Maryland General Assembly has always been, really centered on community. And so we saw it time and time again this session as it relates to public health bills, but also public health moratoriums that the former Secretary of Health, Dr. Laura Herrera Scott, implemented during her tenure.
Yeah, that's great. And I think we'll definitely be having some of those conversations again this next legislative session. It's quickly approaching for 2026. So appreciate your perspective there and always enjoy watching you testify on bills there. So from your public health perspective, how have you seen the opioid epidemic evolve in Baltimore City over the past several years?
Yeah, so I have a very, again, I mentioned before, I have a very unique perspective. So when most people think about the opioid epidemic, they really just think about starting from the 1990s. But I often remind people from a historical perspective, we are looking at post-World War II and how just opioids in general came in and also proliferated into the Black community. And so we start from that historical perspective, and that enhanced and influenced how the opioid crisis evolved in the 1990s, the 2000s, and where we are today. And so we've seen the opioid epidemic evolve into a crisis that we're looking at, particularly from a synthetics perspective. So we are seeing emerging drugs like fentanyl, xylazine, and how they've enhanced, and not only just they've enhanced and also um, prompted many overdose deaths that we're seeing. But what I will tell you is that those disparities are ever present in the city of Baltimore to this day. I mean, when many people think about Baltimore and the opioid epidemic, they think about that New York Times article that prompted Baltimore to be the epicenter of the opioid crisis across the nation. But I looked at it as a way to highlight the historical perspectives, but also to show that Baltimore is a leader in the response to the opioid epidemic that we're seeing evolve since the 1990s.
Yeah, you all have definitely led in a number of ways, what we'll get to on this podcast. So, given the changes and the evolution kind of you've described, how has that changed the kind of resources or partnerships you think that the city needs most today?
So the whole field has changed. So the field response has changed. We are seeing more naloxone needed for the
Hmm.
reversal and also post-reversal monitoring due to fentanyl potency and xylazine's non-opioid sedation. We're also seeing and being in clear reality of the polysubstance reality that there are multiple persons that are actively using that are utilizing polysubstances, and how we at the state level can introduce different monitoring systems to that reality. It's no longer just a one drug for substance abuse. We are seeing that polysubstance reality exhibiting in the city of Baltimore, and that has changed how the resources are deployed. That's changed how the resources are deployed from our emergency departments, our community-based organizations who are on the front lines every single day, but that has also changed our monitoring systems within our state level health department and how they are tracking these emerging drugs within our cities. And finally, I will. And I hate to kind of, I hate to kind of end with this, but we've seen an equity focus. It has really charged an equity focus of how we're existing and seeing these drugs proliferate in the city of Baltimore. The response is more targeted. We're having more sustainable, credible messengers and peer support. And also, we're making sure that we have low barrier medication access in Black neighborhoods to make sure that we are truly closing the gaps regarding access and outcomes.
That's great. And speaking kind of some of the stuff that Baltimore City has been leading in, I saw that you all released your preliminary overdose response strategic plan. So going into that strategic plan that Mayor Scott kind of unveiled, what parts of the plan do you think will make the most immediate difference?
So first and foremost, and I applaud Mayor Scott for providing this venue and this approach for the city of Baltimore. It was very novel, it was very innovative, but also it was something that was needed at the particular time. What I will also share with you that the council is working in tandem with
Mm,
Mayor Scott to make sure that this plan is not only community centered, but also making sure that we have the legislative actions to tie into that overdose response plan, strategic plan as well. So the first thing that we are really addressing is addressing disparities, and we know that African American males, 55 years and older, are suffering at a much higher rate related to this opioid crisis. And so
right.
we're addressing those disparities head on within our community-based organizations, but also within our response. We're making sure that we have increased access to low barrier services across neighborhoods. So it's not just low barrier services related to medication assisted therapy or medications in general. We are talking about low barrier services related to housing, low barrier service related to stabilization beds that can reduce overdoses instantly. We're talking about pairing naloxone distribution with the referral to treatment, and also housing support, because we understand those social determinants of health that are surrounding a person can really impact the person's recovery within the first month, 6 month, and 18 months of their recovery. And then last but certainly not least, we are marrying quality of life issues and also reducing the stigma related to recovery. And that's something that, that behavioral change is definitely gonna happen over a longer period of time as the strategic plan progresses. But it's one of the more challenging issues as people look at Baltimore. They look at the assets in Baltimore and how that immediate impact of dismantling and confronting those stigma is definitely going to enhance our policy, but it's also going to enhance our practice at the state level and also in the city as well.
Mm, right. Yeah, there's a lot of misconceptions there. And this plan, this is the preliminary, so we can expect a lot of community feedback and engagement. I know one of the things that Mayor Scott, I know he's working in partnership with you all on this, set a goal of reducing fatal overdoses by 40% by 2040. I love that the plan centers on reinvesting back into communities while aiming for that 40% reduction. Do you have any thoughts on how to keep residents engaged and connected to that long-term vision?
Most definitely. So first and foremost, we have to acknowledge that, and this is, and if I'm correct, you're really talking about the harm reduction and how it's being
Yes.
perceived, yeah, how it's being perceived and conveyed in communities. So first and foremost, and this is something that we've done primarily with the listening sessions, is that we
Mm,
are starting with shared goals. We understand in our communities that we want them to be safer. We want residents to have safer neighborhoods. We want to have fewer overdoses, and we want to have a better model of harm reduction that is really centered on sustained recovery. Now, what I will say is that we have to get clear on connecting those quality of life to practical outcomes. So
mm,
when we're looking at the syringe services programs, we know that we need those types of programs within our neighborhoods because it means fewer needles on sidewalks. It means fewer HIV and hepatitis C cases, which we're seeing relayed in hospital costs. We know that we need to have mobile outreach teams and naloxone within community to have fewer public overdoses. But what we are finding is that the permeation and the connection to community and how that exists every single day in community, whether it be through Department of Public Works response, Department of Health response, and or how that exists for the everyday resident, we have to begin to do that a lot better. And that means making sure that we have enhanced response teams related to those syringe services cleanup programs for our communities, making sure that those mobile outreach teams are going into our communities overnight, connecting with homeless outreach teams, because everything is interconnected. You know what I'm saying?
Definitely.
Everything is interconnected. And from there, we need to show that those bridges of recovery to make sure that folks know that harm reduction is a long-term sustained process. It's not just the first process. And so as we see this plan enact over time, we see the partnership with City Council, we see the partnership with you all and MACo, NACo, and at the state level in government. We're going to see that bridge to recovery is multifaceted, but it's going to come from a place of looking at our tax dollars, looking at how we're using our tax dollars within our city, making sure that it's the most efficient as possible in this financial climate, but also making sure that it's tailored and the approach is recommended by community and for community.
And the lawsuit, the money recovered from the opioid manufacturers and distributors obviously plays a huge role in this, especially because of the budget concerns that every jurisdiction, including the state, is dealing with. And that's an area where the city has been very active. You all have really led in this area in lawsuits against the opioid manufacturers and distributors. And how do you all envision those settlement funds being used to create those long-term solutions rather than just the short-term fixes?
Yeah, so first and foremost, I believe that, I just want to highlight Executive Director Sarah Whaley, who is leading the Baltimore City Overdose Response Team and also the Opioid Restitution Advisory Board. And so through the Restitution Advisory Board, which is a community member and lived experience centered board, we are utilizing those funds to primarily focus on treatment outcomes, but also making sure that we prioritize prevention as well. We want to make sure with those dollars that we are upending positive treatment programs with sustained and positive and tracked results. But we also want to make sure that we are looking at the social determinants of health, like housing, workforce, family stabilization with those dollars as well.
It's good. And then also, how do you all balance holding companies accountable for past harms with building that forward-looking strategy for recovery?
Yeah, and that's something that I believe is ongoing. What I will tell you is that we are looking at it from a shared partnership and shared responsibility perspective. We understand the harms that are done within the city of Baltimore from these pharmaceutical companies, but we also understand the positive aspects that can be gained from really looking and identifying programs and approaches that will positively uplift community from this harm. So that means we're looking at making sure that we don't have pharmaceutical deserts within the city of Baltimore. We're looking at how we can have a shared approach to proper medication assisted therapy, proper medication assisted usage within our communities. Those are these are opportunities of partnership with these pharmaceutical companies, but there are also opportunities for empowerment for a community as well, to speak safely about taking back our communities with concrete public health solutions.
Absolutely. I think that'll probably be another conversation that continues in the General Assembly, especially next year. And so something that you were saying about harm reduction and the strategies that Baltimore City has been utilizing there, I think harm reduction strategies often spark debate. How do you convey their value to residents who may not understand the evidence or might just not know the evidence behind the harm reduction strategies?
So I think we have to step back a little bit, because what I've been sharing in Baltimore is that harm reduction is an approach, an initiative that we need not only just for the city of Baltimore, but we need within the state of Maryland. So using that model, we need to make sure that we convey real local and state level wins related to harm reduction. So harm reduction is so much more than just the REN services program. There's so much more than the mobile outreach team. It is really showcasing how people, not only within themselves, but also within their family, can enter treatment and stay connected to health and housing services. And once we have tangible ways to showcase that, we'll be able to bring people on board with how harm reduction is positive for our communities. We have to be able to showcase that, one, we have a handle on our governmental systems and processes and operations within our municipalities like Baltimore, and how that connects with the harm reduction model. So making sure that persons in recovery can live in a quality environment. They can live in a space where we don't have public safety issues. They can live in a space where they can have a career or workforce development that ties into their everyday life to uplift their everyday life. And so once we start connecting harm reduction to better quality of life, not only just for that person, but for communities, that's when I believe people are going to showcase and see the true benefit of the harm reduction model.
Absolutely. And that's a great way to kind of resonate with an audience that may have been skeptical. I think there's a lot of ways that other jurisdictions can learn from you all in this area. So that's great. And so as a representative of South Baltimore, what unique challenges do communities in your district face when it comes to addressing opioid use and public health more broadly as well?
Definitely. And this is something that I'm super grateful to be a representative for South Baltimore during this particular time, because we are seeing the opioid addiction and crisis a lot more poignantly than other districts as well. We're seeing the oversaturation of clinics without necessarily enforcement and quality control. We are seeing fragmented systems and neighborhoods that are feeling like, the bad actors are not necessarily being enforced upon. We're seeing community fatigue and frustration for visible overdoses, unkept promises and fixes, and really just honestly not utilizing the harm reduction model that I use. But I will tell you, I'm so grateful because I have this expertise in this time and place. I am able to begin to shift the atmosphere and the narrative of how we are balancing enforcement and harm reduction in South Baltimore. So we have taken a much, much, much better concerted approach with how we're existing with those issues of community fatigue, frustration, oversaturation of clinics. And that was something that I talked about during my 4 legislative oversight hearings within my committee, the Public Health and Environment committee that I chair for the City Council. We're seeing that the balance enforcement and harm reduction, we're shifting towards health first strategies, and we're reframing the conversation. And we are seeing that happen more and more within our communities of South Baltimore. We're seeing that there are positive actors within the harm reduction space. And we are showing that when we have an opportunity for communities to show up and integrate, that the public health interventions that can be executed reduce the calls for police, reduce, quality of life crimes that can be associated with addiction, and we can create and build healthier neighborhoods. And last but certainly not least, in South Baltimore, I'm implementing a positive strategy as it relates to making sure that each of our policy approaches that we look at related to this opioid and addiction crisis have an underlying social determinants of health aspect associated with it. As I said before, housing instability, unemployment, food security, lack of green space make recovery harder and make very clear, and also a likelihood that a person would relapse more likely. And so all of the policies that I'm pushing within the committee that I chair and also within South Baltimore, we must integrate mental health. We must integrate housing and workforce development, not just in the short term, but in the sustained approach for that person's recovery and also for their family and community as well.
Absolutely. And I know, I think you say this before in South Baltimore, you all have a lot of neighborhood level organizations that you partner with, and they play a role in help meeting some of these challenges. Anything else you want to say on that?
No, there's nothing else to say. What I will say also, just to close this out, is that we here in Baltimore, while we are a leader in this space, it's imperative that all of the localities within the state of Maryland work in partnership to solve this crisis. We understand what's happening at the federal level is definitely impacting how our state level and also our localities are showing up, the resource allocation, and also the way that these programs are existing within our communities. We have to partner, and I'm so grateful for opportunities like this to share the message of what's happening in Baltimore, but also to the larger MACo community. It's a call to action. It's a call to action for partnership. It's a call to action for sharing very innovative approaches and lessons learned, what we're doing here in Baltimore, but also what Baltimore can learn from the state of Maryland.
Absolutely. Really appreciate that perspective. And going to look forward to working with you this next upcoming legislative session. And of course, outside of that as well. But Councilmember Porter, thank you so much for taking the time to chat with us and our listeners. We really appreciate your time.
Thank you so much. And I look forward to partnering with you all in the future.
Absolutely. All right. Well, that is it for us. If you enjoy hearing about local politics and policy, be sure to subscribe to the Conduit Street podcast from whatever device and service platform you choose. You can follow us on the social media platforms of your choosing and the Conduit Street blog. On behalf of Councilmember Porter, this is Karrington Anderson. Goodbye, and we will talk to you soon.